some things similar to Corinne. First of all, good to be with all of you today. You just heard Corinne give an update on the president, and I'm happy to answer questions about his health in a second. As you heard, we FaceTimed with the president earlier today. I also spoke at length multiple times today with Dr. O'Connor. And as you all saw just a few minutes ago, the president is doing better. He slept well last night. He ate his breakfast and lunch. He actually showed me his plate. Didn't ask about the menu, but I did see an empty plate with crumbs, and I have some guesses about what was there, but didn't ask.
No comfort food?
Didn't ask. I did ask him about his appetite. He joked that his one regret was that his appetite had not changed. Look, he is in a very good mood. I want to take a step back and emphasize the message that you heard from Corinne. As the White House COVID-19 response coordinator, what I think every American needs to hear, what the president laid out, is that while we have a very contagious variant out there, thanks to this president's leadership, we have the ability to manage this. We are now at a point, I believe, where we can prevent nearly every COVID death in America. That is a remarkable fact. So if you are vaccinated but have not gotten a booster, this is a really good time to go and get a booster. If you're over 50 and haven't gotten a vaccine shot in the year 2022, this is a really good time to go and get a shot. They are free, they are widely available, and as you heard, if you are over the age of 50 or have any kind of chronic condition that meets CDC criteria, please consider getting treated if you have a breakthrough infection. And if you don't have a regular doctor, you can go to covid.gov and find a test to treat site near you. I also want to share some data about the progress we are making both on vaccines and treatments just over the last couple of weeks. Over the last 7 days, we've gotten 2.2 million more shots into people's arms. That's the highest we've seen in a month. More than 900,000 Americans have gotten their second booster shot in the last week. That's the highest number in 6 weeks. So as Americans go about their daily lives this summer, they're heeding the public health message. And not just on vaccinations, by the way, on treatments as well. You know, when I started in this role about three and a half months ago, we were seeing less than 4,000 prescriptions a day of Paxlovid. Now Paxlovid prescriptions are at their highest level. Last week, about 40,000 courses of Paxlovid were prescribed every single day across America. It's a remarkable fact. And if you think about the fact that we have about 120,000 identified infections, even if you assume that some infections are not getting identified because of home tests, it's a large proportion of people getting Paxlovid. I think that's really good. It's preventing hospitalizations. It's preventing deaths every day. Overall, just so far in the month of July, 920,000 Americans have benefited from Paxlovid. We have secured 20 million courses of Paxlovid. That's the most in the world by a lot. And again, we've made it widely available and, of course, free. All right, let me finish by providing what I think is really the bottom line. It's great to see the president doing better. He's doing better because he is vaccinated, he is boosted, he's getting treatments. He is getting world-class treatment, exactly what you would expect for the President of the United States. And the President has made clear to us that it's incredibly important to him, and therefore it's incredibly important to all of us, that all Americans have easy, free access to the same world-class treatment that he's getting. Vaccinations, therapeutics. So my message to my fellow Americans really is this. Please avail yourselves of this vaccine to build up your immunity. Please avail yourselves of treatments if you qualify, if you get infected. And let's continue to do everything we can to prevent serious illness and death from this pandemic. All right, thank you very much for listening, and I'm happy to take questions as I know.